Hello and welcome. My name is Dr. Galen Bartlett. I am the chiropractor here at ADIO Chiropractic in beautiful Peoria, Arizona. I wanted to take a couple minutes and spend some time with you guys today. One of my passions and one of my biggest purposes in life is to help you reach your full potential. I want your full potential with your family. I know we have parents here. I know we have bosses. I know we have athletes. We have everybody in between. And one of the biggest reasons I'm here is I want to help you get to where you need to be to reach your full potential in these areas. Specifically in the area of your health care. I have so many people come into my office with all these problems, and they've been to all these doctors, whether it's being neurologists, orthopedists, naturopaths, whatever it is, and they're looking at you as a sum of parts rather than a whole body. You're going to an endocrinologist, you're going to a neurologist, we're going to a cardiologist, we're going to a pulmonologist, all these different things for all these different parts of your body, and a lot of times there's just no answers. What I want to do is I want to pull it all together for you today. I want to explain to you how we're going to look at your body a little bit different. I know if you've already been in the office, we've taken a shot of x-rays of you most likely. What we're going to do on that next visit is we're going to go over those pretty in depth with you. And I want you to understand, for one, why we took those and why those are so important, but two, what's really behind them and really what we're going to be looking for when we review those together. If you're from out of state and you've been sent this video by a friend, a family member, and you're interested in finding a chiropractor in your area, please reach out to us. Please reach out to my team at 623-256-6458. You can reach out to me, Dr. Galen, DrGaylen, at adioaz.com. I'd be more than happy to find somebody in your area. But to dive in here, one of the biggest things, and I call it the elephant in the room, is what's going on with healthcare in our country, in America. We spend, and this probably is no surprise to most people, we spend number one on our price of healthcare. The amount of money that we spend on healthcare in our country, if you were to add up the 10 countries after us, it still doesn't equal what we spend on our healthcare. And the majority of this is medications. We take far more medications than the rest of the world. We make up about a very small percentage of the world population, but we consume over 75% of the world's pharmaceuticals. So that's where a lot of this healthcare spending is going. And from an investment perspective, you would think if we spent the most amount of money on our healthcare, that we would have the healthiest population. But that's just not the case. That's just not the case. The World Health Organization, the last time we looked, the last up-to-date statistics we have, they ranked us in the bottom 30%. The bottom 30% of overall health. I actually read that we're almost dead last in infant mortality rate among all industrialized nations, which means we have the most deaths per 1,000 births out of all industrialized nations. So what we learn from that, what we can take away is we spend the most, we're not getting the proper return on investment, and really from the very start of life, the paradigm of healthcare in our country is broken. So that is the reason that we're here. That's the reason I want to take a couple minutes with you and explain to you a better way, a natural way, where we can start living our life to get more out of it, to start fulfilling our purposes, being a better, more vibrant version of ourselves for our family, our coworkers, our teams, wherever we are. We want to be more and we want to get more out of it. So let's dive on in. Optimal health of your body. If I were to ask you to name what you believe optimal health is, a lot of people would come back to this absence of symptoms. I don't have X, Y, or Z. I don't have a cold or a flu or a runny nose, or I don't have trouble breathing, so therefore I am well. Right? An absence of symptoms is correlated in our country with wellness, and that's just not the case. You can be a day away from a cancer diagnosis, have no symptoms, be a day away from a heart disease diagnosis, have no symptoms. One of the first signs of a heart disease is a lot of times a heart attack. That doesn't mean they had any hard symptoms of that prior to that. What we do in our office is we judge your health based on how health is actually supposed to be judged. And this is optimal function of your body. How is your body functioning? And I'm going to prove this to you. When you were just before you were even created, mom and dad came together. 2 cells created 4 cells, 8 cells. The replication started happening until it started to become you. What happens about a week after conception? Your full nervous system begins to develop. And that's the very first thing that begins to develop when you're just a thought in your mommy's belly. Is this nervous system gives life to every other system in the body. Now, your nervous system is is your brain and your spinal cord. Fast forward today, fast forward to that little baby. That nervous system is that brain and that spinal cord. That brain and that spinal cord give life to every other system in the body. It provides function to every other system in the body. It's the whole reason you can go to bed tonight. You don't have to think about your hormones. You don't have to think about your heart beating, your lungs breathing, your stomach digesting food. Your central nervous system, your brain, is sending signals down through your spinal cord, inside your spinal cord, out to every cell, every tissue, every organ in your body, telling it exactly how to run, exactly how to function, and what order it needs to do it, and it is perfect at it. It's perfect as long as it's functioning properly. Now, this is the same power that made you out of 2 cells, is the same power that keeps you going today. It's the same power that if I cut my finger, I know it's going to heal. It's the same power to where I know if I have a digestive issue, I know if I don't get in the way of it, my body is going to heal that digestive issue. If I have a heart issue, my body has the ability to heal that. If I have a lung issue, my body has the ability to do that if we remove the interference to your body's ability to do that. So, to review, your brain sits up here, sends signals down through your spinal cord, inside your spinal cord, out to every cell, tissue, and organ in your body. That is how your body functions. That's the most important thing when it comes to your health. Here's the issue. God gave you an insurance policy, the spine here. The main purpose of your spine, when people think about this and they think about going to the chiropractor, they think about posture a lot of times. That's good. This keeps you upright. It keeps your posture. It makes sure we're not a bag of bones on the floor. But the main purpose of this guy is to protect that system we just talked about, that brain, that spinal cord, those spinal nerves. Your brain sits right up here, sends signals down through your spinal cord. These top 2 bones, your atlas and your axis bones, they actually surround your brainstem area. That's why those are the very first 2 bones that we typically check in the office. They surround your brainstem area, so that's extremely, extremely important. If those bones, something's going wrong in those bones, and they're putting pressure on your brainstem, you're going to have issues out in your body. It could be digestive issues. A lot of times for a lot of people, it's things like dizziness, headaches, it's things like thyroid issues. It's anything really, because it's putting pressure on those nerves at the very top, so that signal from your brain can't make it all the way down. Now, all these bones are meant to protect these spinal nerves. They're meant to protect your spinal cords, but you have all these spinal nerves coming out in between your bones. We stress this guy every single day. We brush our teeth. We're taught to take really good care of our teeth. We're not taught to take really good care of the spine, but we stress this thing every single day. So as we wear and tear this, what starts to happen, these bones can become misaligned. Your body can protect it. It can keep them from moving. And what starts to happen is you get inflammation and irritation in those joints. That's what a lot of times people come into the chiropractor for, is because they have a back pain. That's really not the main issue, though. When your body locks that area down and causes inflammation and irritation in that joint, what it's actually starting to do is cause inflammation, irritation on that nerve. It can put pressure on those nerves. It can put pressure on that disc, which squeezes on that nerve, and that causes dysfunction out into your body. If you were to put pressure on this nerve going out to your heart and lungs, the function of your heart and lungs aren't going to function as well. If you put pressure on these nerves going down out to your digestive organs, the function of those organs aren't going to function as well. Almost without, every single time when somebody comes in here with low back issues or they have sciatic issues, there's almost always a digestive issue attached to it, a reproductive issue attached to it, because there's pressure on those nerves going out to those same organs. So the whole reason that we look at x-rays, I'm not trying to find the source of your back pain. I'm trying to find where this is being interfered with, where that nervous system is being interfered with, so that we can go in there, we can take pressure off the joint, start to get your spine moving properly. But really, we need to let those nerves heal. We need to allow that nervous tissue, the spinal nerves, the spinal cord, all those joints to start to heal. So that's really the biggest reason that we're even taking a picture of this, that we're looking at it. That's the reason you're here. Because as we take the pressure off of those nerves, that is when your body is going to be able to start to heal. Now, when you look at, I have this chart here, this shows you exactly where all these nerves go to. Up here in the neck, your brain sits right up here, sends signals out through these nerves, out to every single cell, tissue, organ in this area. Going out to your thyroid. You can cause issues. You can have issues in your head, your ears, your eyes, your nose, your throat. These are the nerves. When those bones shift and they put pressure on the nerves, you can have issues in your heart, your lungs. Down here, you can have issues in your digestive organs. You can have numbness and tingling in your feet. You can have reproductive organs. I can't count how many times we've had people come in here with low back issues, but they also tell tell us they have fertility issues as well. There's a lot of pressure on the nerves down here. What we do when I look at that x-ray that we took, everything I'm thinking of when I look at that, I'm trying to find exactly where that nervous system is being interfered with so that we can go release that life, so that we can get that brain communicating down through that spinal cord, out through those nerves at 100% life. Because here's the deal. Here's what happens. Right now, as we're speaking, your body's creating new cells. You know, if you brush your hand, I just brushed millions of skin cells out into the air. I'm not worried about that because my body's constantly producing new skin cells. Right now, my body's producing new heart cells. It's producing new digestive cells. Every cell in your body is constantly being regenerated, right? And every 7 years, you actually have a completely new body, bones and all. Not many people realize that. Because your body is constantly reproducing cells, you're constantly becoming a new person, right? So what we're trying to do in chiropractic is I want to keep the pressure off of those nerves. I want to keep that part of your spine that hasn't been moving long enough for your body to heal itself. Not only that joint, that's when you start to feel better, is when that joint starts to get healthier. But when your body starts functioning better is when all those tissues are no longer creating themselves sick because you've had the lights turned off or you've had pressure on that nerve, dimming that signal out to those areas. If you've had pressure on that low back for years and years, you've had a lack of signal getting out to those digestive organs. We're taking the pressure off and now allowing life to get back out there. It's going to take a little while for your body to rebuild itself healthy. But that's where we start to see amazing things in chiropractic, is when we start to take the pressure off those nerves, we maintain the motion, we maintain healthy nerve flow out to those areas over a long period of time. That's when your body can start to really function, heal, and operate the way that God intended it to. So a lot of times, this is one of the main questions I get, especially when we look at x-rays, is how did this happen? How did this happen? We'll look at somebody's x-rays and they have stage 2, stage 3 degeneration, and maybe they've only been in pain or had an issue for a couple weeks or a couple months. And my answer is always the same. I have no idea. I'd have to have a picture, a video of your whole life to look back and see this little slip and fall, this way you're slouching at your desk, all these little things, this big car accident. For most of us, it's a combination of two things. It's a combination of big traumas and little traumas. The big traumas and the little traumas. The big traumas are obvious things like car accidents, trips and falls. I slipped on the ice one year back when I was a teenager. Those are big things. Those are the things that can cause your spine, your joints to go out of alignment instantly. For the majority of us, the one that's the most common is the smaller things. It's the way that we're sitting at a desk. For me, I'm bending over a table adjusting patients all day. It's the way that we're sleeping. It's the way that we're picking up kids. It's you moms, the way that you're breastfeeding constantly for years and years and years. Those little tiny stresses, when you do it once, twice, 3 times, it's not a big deal. But when you're doing it constantly over and over and over and over again, you're stressing those joints in a way that they become permanent. Kind of like braces on teeth. If you keep pressure on those teeth long enough in a desired position, they start to change. Your spine's the same way though. If you're slouching at a desk the same way for years, or you're feeding a baby the same way for 2 years, that spine starts to change. And we're not taught to take care of it, but that's why we're having this conversation right now. Now, an important thing on that same thing for a lot of us with kids, especially a lot of us with kids that have problems, a lot of us with kids that have a lot of symptoms that they just don't, all the other kids are healthy and my kid's always sick, or my kid always has ear infections, my kid always has fill in the blank, attention deficit disorder. A lot of this can happen during that birthing process. I mentioned at the beginning the way that we do birth in this country, and moms, a lot of times we just don't know. We just don't know right from wrong. We kind of believe whatever our doctors tell us. The birthing process in this country is very rough on mommy and baby. A lot of times in the hospital, they have mom laying on her back, which means there's upward pressure on that sacrum, that bottom bone, right where the baby has to come out. This is actually, they teach us a test in chiropractic school, an orthopedic test to lock down that pelvis. And this is a very similar situation that they teach us to put mom in, or to put a person in, to where we can lock down that pelvis. And that's the same position they have you in while you're meant to deliver a baby, where that pelvis is supposed to open. They also use things like vacuums and forceps. And a lot of times, you're pulling on that baby's neck with an extreme extreme amount of force. So for a lot of our kids, that subluxation, where that bone shifts and it starts to put pressure on those nerves, starts at birth. And we see things when moms have kids with ear infections, and I initially start to check that baby for any interference in that baby's spine. A lot of times it's so obvious right here at the very top, that bone's sticking out the side of their neck. And that's something that happened at the very beginning, where we either pulled that baby out of mom, or we use forceps, or we use a vacuum, or even worse, moms don't know this a lot of times because they cover moms up from being able to see when they have a C-section. But when they pull that baby out of a C-section, mommy's abdomen is actually acting as a vacuum. So they have to use so much more force to pull that baby out, and a lot of times that can be equal to like a grade 3 sprain on that baby's neck from the very beginning. So it wouldn't be a huge issue if these babies were getting right into a chiropractor afterwards that was checking them for this kind of thing, but moms don't know. So the baby goes on through life, and all of a sudden they start developing all these symptoms. That's when this starts to happen. It starts from a very early age, and then all of a sudden baby starts to become a young kid, a teenager, and he's having migraine headaches, a lot of frequent headaches, allergies, ear infections, sinus issues. All these things, they're not normal things. None of this is normal things. If that stuff is going on, there's a reason for it, and we need to get to the cause of why it's like that in the first place. So that's why in our office, and we're about to end here, but in our office what we do is we offer family maintenance care. One thing that I don't like to see is mom and dad come in with problems that they've been working on, that they've been developing for the past 10, 20, 30 years, and their babies are sitting watching them get adjusted. We offer family care plans. We offer family maintenance care because of how important it is to have our kids checked. And they don't need to be checked off often. A lot of times mom and dad come in, they have an issue that needs a lot of work. That's fine. The kids don't need to be checked that often, but they do need to be checked to make sure that we're not developing these issues. Make sure they're not developing any of this. And even if they're completely healthy, perfect. That's the best time. Let's keep them that way. We want to live a life of vibrance. We want to live a life that we don't have to worry about sickness. When you live understanding all the things that I just explained to you, you understand that nervous system, you understand the power that created you from 2 cells and how powerful that is to not only heal your body, but to rebuild it. You'll start to live a life with a lot less fear. And that's what I want for you guys. And I want to help you guys get there. If you guys need anything, if you guys have any questions, like I said, if you're a new patient in the office, we're going to be going over your x-rays on that next visit. Extremely important. I'm going to show you exactly where these interferences are, and I'm going to talk you through exactly how we're going to get to the bottom of it. This is very, very important. If you have questions though about your family, you guys have specific questions about you, type it in the comments. You can shoot me an email, Dr. Galen, DrGaylen @ADIOAZ.com. You can give us a call. We're here to help you. We're here to be a resource. So I hope you guys have a beautiful rest of your day. Please like, share this video, subscribe to this channel. We're going to be giving you a lot more content here in the future. I hope you guys have a beautiful rest of your day.